going to go live now to Queen's Park, where the Ontario Health Coalition is releasing a new report on the closure of hospital departments across the province. We'll listen in.
116 urgent care centre closures, 2 outpatient laboratory closures, one of them long-term, in communities where there is no other lab. So that's the only outpatient lab. 11 obstetrics closures, 1 labour and delivery closure in Hearst, Ontario, which is more than an hour away from the next nearest hospital, and a number of ICU closures. I mean, these closures are staggering. The numbers are like nothing we've ever seen before. These are the most urgent healthcare services that we have in our local communities. They mean, without question, that people's lives have been put at risk. In some areas of the province, like Western Ontario, you can drive to one emergency department at night, say Wingham, it'll be closed, and then the next town is closed, and the next town also. Patients are being told that they have to figure out in their emergency whether or not the next emergency department is open. There is no notice often for the closures, so people, they might be told the day of that their local hospital is closing that night, and people may or may not know. People have lost total confidence in the stability and security of the emergency system in our province. In Northern Ontario, towns that are an hour away to 3.5 hours away from the next nearest service are facing closures. Towns like Red Lake, northwest of Thunder Bay, continue to warn that they're facing imminent emergency department closures. Their urgent care center is facing Saturday closures. It's 3.5 hours from Red Lake to get to Kenora on a clear day without road construction. Places like Kirkland Lake, Hearst, all across the north, the far-flung areas, even Mindamoya on Manitoulin Island, warning of potential emergency department closures because they're so short-staffed. In the south, in the east, and down towards Niagara, Hamilton area, we're also seeing closures, shockingly, in some of the largest hospitals in the country, in Carleton Place, in Kingston, in Hamilton. The ICU had about a third of the ICU. Can you imagine this? In Hamilton, closed because of short staffing, as well as the emerge department closures in the small and rural communities across the east and the west and down into Niagara and the middle of Ontario. These really are distressing. Very much should be the very top of the public policy agenda in Ontario. One would think that we would be seeing serious action to address these because they are the most urgent services and people's lives depend on them, but that's not what we're seeing. The immediate cause of the closures is, of course, the staffing crisis. It's a lack of nurse staffing, in some places a lack of physician staffing, and others health professionals. But almost nothing is being done. And in fact, the government has pursued policy that has made it worse. Leading into the pandemic, when just in the few years before the election, things had opened up again, and after years of austerity, we were starting to see money flowing again to the hospitals. Too little, too late, but there was a little bit. 2018, the Ford government came in, they brought in austerity again, cut hospital funding to below the rate of inflation during the pandemic, and so we went into the pandemic with zero surge capacity, and the staff was walloped by the pandemic, which is ongoing, and we have abandoned all public health measures in this province. So there's no even public education about the rates of COVID, which are very high, RSV and flu that are swamping our public hospitals. And each wave, the staff gets hit again and again, and they're leaving. They've left by the thousands, and they continue to leave. This year, hospital funding is increasing at 0.5%. Healthcare inflation from September to September, so in the last year, according to Stats Canada, is 5.6%. So a huge gap, real dollar cuts for public hospitals in the context of the worst staffing shortage we've ever seen. And the government is fighting in court to bring back Bill 124 and wage suppression legislation, again, inexplicable in a state in which which we are having emergency departments and birthing closed, across the province in our local hospitals. So we need leadership. We need the Ford government to take responsibility for the planning of our health system. It's primarily their job. We should be seeing the Premier on TV in high rotation commercials, calling back the recently retired staff, smoothing the way, paying their licensing fees, offering incentives, getting all boots on the ground. It should be an all boots on the ground effort commensurate to the emergency that we're having across the province. And instead we're seeing nothing. The release of this report is an attempt to put some pressure on the Ford government to finally take some action to address this crisis. And we have some speakers here with us today. So I'll introduce,
We've just been listening in live there to the Ontario Health Coalition releasing a new report on the closure of hospital departments across the province. That report says that these closures are like nothing they've ever seen before, meaning people's lives are being put at risk. And they are calling on the Premier to address this with the leadership that they should have, saying that they need to see incentives, licensing fees and other incentives to get more people into the workforce and reopen those closures.